Good morning, everyone, and welcome to our session. I'm really excited about the work we're going to do today. We should have something for everyone, for employees, for parents, for those concerned about their neighbors or community members. And we want you to walk away with some either refined or new strategies to deal with this stressor, the COVID stressor. We have the chat enabled, so you're able to add your comments as we go along, your questions or comments. And we will pause several times during the session to engage some of the comments or questions in chat. We have an interactive feature where we're going to ask you to respond to some questions and engage in dialogue. And then we'll hold some time at the end of the session for open questions and answered, where we'll ask everyone to maybe even unmute their mic if you're comfortable in doing so, and we'll go live and have a live question and answer session. So let's look at the objectives for the presentation, and we'll get started here. Firstly, we want to establish a context for the discussion. What's important about COVID? How does it affect us? How do we deal with it? We want to sort of establish a context for a broad discussion about this topic. Next, we want to create space for participant reflection and resource identification. We want to, in other words, create some time and space for you to reflect about your concerns, reflect about your experience, to identify some resources to move forward. And ultimately, we want to establish a momentum and even a community for ongoing problem solving. We're all in this together, whether we have COVID directly, whether it's someone in our family, whether it's a coworker or a neighbor, we're all in this together. And so we want to establish momentum for ongoing problem solving and support. So let's look at the context here briefly. I think we would all recognize that the COVID pandemic is likely very stressful for most people. Again, whether you have it directly, whether it's someone in your family, whether you're a coworker or your neighbor, it's just a situation that's likely stress producing for most people. Fear and anxiety about a new disease and what can happen can be overwhelming at times and can cause strong emotions in adults and children. And so again, we want to think about our own experience. We want to think about the experience of our coworkers and our neighbors, but we want to also be really concerned about how our children are responding. And we've got some supports available for children as we move through the presentation. We'll take a look at some of those supports for children as well. Public health actions such as social distancing can make people feel isolated and lonely and can increase stress and anxiety. But we know that these actions, social distancing and public health requirements, hand washing, so forth, are necessary to reduce the spread of COVID. So we want to really be conscientious about engaging in the public health actions to mitigate, to moderate the stressor. And ultimately, coping with stress in a healthy way will make us feel comfortable, take care of the people we care about, will improve our health, and can make our community stronger. So what I'd like to do is pause for a moment for some group level reflections, and I'm going to encourage you to the extent that you're ready to put a few of your responses in the chat. So we've got 4 questions here for you to reflect on, and then we're going to pause and take a look at some of your responses. Firstly, and again, you can activate your responses in the chat. What is concerning you regarding the current health crisis? Maybe it's an individual concern, maybe it's a family or parenting concern, maybe it's an organizational concern. What is concerning you regarding the current health crisis? Next, how do these factors or concern influence your role taking at work? Next, what impact or influence does this situation have on your life away from the organization? For example, your children, your spouse, your other relatives, your social connections, and so on. This social connections is very important. Many of you are really comfortable prior to COVID with having lunch or dinner or coffee with people, going out to social events with people, and now that's been restricted somewhat. So how does this situation impact your life away from the organization, from a family or social paradigm? And then finally, what strategies have you employed to moderate these stressors? So let's take a minute for those of you who'd like to place some comments in chat, responses in chat, and we'll engage some of those comments. Okay, we have one comment here. Changing information about COVID is really concerning, and you're right. The information continues to change. The situation continues to evolve, and we're required to kind of stay abreast of the changes and adjust as we move forward. That's a really good reflection. Another comment here, concerns are about the unknown, the ambiguous, absolutely. And we've got some really nice questions and responses going here. Concerns about elderly relatives, concerns about contracting COVID individually, ourselves, concerns about extended relatives, loss of social connections, our own mental health, our own emotional well-being. These are some really nice reflections. Let's continue here for a moment. Concerns about family members who work outside the home and then coming home to visit. Absolutely. Yes, we have some concerns about maybe individuals who are not practicing public health preventative measures like wearing a mask, hand washing, social distancing. That can be very stressful as well. And there's a really nice comment. All of these are really nice comments. A really nice comment here is about the disruption in the sort of support that children can receive, the disruption in the school schedule, disruption in childcare services. Yes, that can be very, very stressful and demanding. Absolutely. Some comments here about family members being first responders and the risk that they encounter in their role taking. Very nice comments, very nice reflections here. A very comprehensive set of comments here, very good. So again, I want everyone to, as a consequence of this presentation, heighten their resource list to deal with the stressor, and maybe try to take away something new as a consequence of this presentation that you can use to help deal with this situation, the COVID stressor, moving forward. So we're going to move a little bit out of the chat right now. You can continue to put your questions and comments in there, and we'll come back to chat momentarily. But now we're going to move out of this group level reflection into another part of the presentation. So let's take a look at some of the common stress reactions during a pandemic. And you may take a look at your own experience, take a look at some of the experiences of your coworkers or your family members or neighbors, and see where you might fit into these common stress reactions. This is a summary, non-exhaustive list. Firstly, there can be fear and worry about our own health, and the health of our loved ones, concerns about our financial situation or job, or loss of support services that we may rely on. Again, there was a comment in the chat about childcare, which can be a support service, maybe some other kind of support service in our community that could have been disrupted as a consequence of COVID. And so that can be very concerning. It's typical, not unusual for individuals concerned about the pandemic to have changes in their sleep or eating patterns. We can experience difficulty sleeping or concentrating. We can have a worsening of chronic health conditions. For example, if I have COPD, or if I have a heart condition, or maybe if I have diabetes, that those conditions are likely or potentially exacerbated by COVID. There can be a worsening of mental health conditions. For example, it's possible that there can be a worsening of mental health conditions such as anxiety or depression or other mental health conditions. And it's possible that because of the COVID pandemic, that someone may increase their use of alcohol, tobacco, or other substances. These are some of the common stress reactions. So again, take a look at your own experience or the experiences of your loved ones or coworkers or friends or neighbors and see how you would fit there. Now, each person would have a unique response to stressful situations. I mean, we've got a cross-section of individuals participating in the program today, and each one of us is likely to have a very unique response to the situation. How we respond to stress in general, particularly in this case, the COVID pandemic, can depend on our background, the level of social support we receive from family or friends, our financial situation, our health and emotional background, the community we live in, and many other factors. And so, we want to sort of set the platform here for kind of empathy and social support for others. We want to be concerned about our own well-being and engage in self-care for our own situation. But we also want to be empathetic that people around us are likely to have some similar but very unique responses to this stressor. Now, the changes that can happen because of COVID and the ways we try to contain the spread of virus can affect anyone and is likely to affect all of us in some way. Staying with this notion of unique reactions to stressful situations, people who may respond more strongly to the stress of a crisis include, this is a summary list, people who are at higher risk for severe illness. For example, people who may have cancer, chronic kidney disease, COPD, severe obesity, heart conditions, type 2 diabetes, mellitus, or some of the people who have serious health conditions who may be more at risk because of COVID. And then other people such as the elderly and people of any age with certain underlying medical conditions. Let's move back to several slides here. Let's move back another slide. Okay, let's stay here for a moment. So children and teens, let's remember that children and teens may be particularly at risk for stress associated with the situation. For example, in our children, we may experience excessive crying, sadness and worry, decreased school performance, attention difficulties, and unexplained physiological conditions. The same sort of symptoms may emerge in our teens. And so we want to provide support. We want to encourage. We want to let them know that we're going to get through the situation. We want to reassure them that we're able to deal with the situation effectively. We want to reassure them that resources are available to help them deal with the situation. For those of us caring for family members or elderly relatives, we can particularly have a very unique response and be concerned in that regard. Frontline workers, such as healthcare workers and first responders, can get overwhelmed, feel burned out, be concerned about ambiguity or uncertainty, be concerned about their own health condition and how their exposure to COVID may affect their family members or loved ones. So each one of us is likely to have a unique reaction to a stressful situation. And these are some just of the summary target groups. Let's move on. Now, some of the people who may respond more strongly to the stress of a crisis include people who have existing mental health conditions. Again, someone who may have a pre-existing psychological condition such as anxiety or depression or severe mental illness such as schizophrenia or bipolar disorder are likely to respond more severely to the pandemic. People who use substances or who have a substance use disorder are likely or may be inclined to use those substances in greater frequency with greater intensity. Individuals who have lost their jobs, maybe who have had their work hours reduced or had other major changes in their employment are likely to have very, very intense responses to this situation. People who have disabilities or developmental delay, maybe because of mobility, because of their decreased ability to communicate their medical needs or communicate the onset of their symptoms, are going to have a unique response to the situation. And then of course, people who are socially isolated from others, including people who live alone or people who live in rural or frontier areas. Staying with the unique response to stressful situations, some people in racial and ethnic minority groups may have an intense response because of the dynamics of discrimination, because of potentially their limited access to healthcare resources, because of their occupational exposures. There is some evidence that some minority group members who are in certain occupations, particularly healthcare occupations, are likely to have more exposure to COVID and therefore have a more intense response. And then because of some of the housing challenges. Staying with this notion of unique reactions to stressful situations, we'll review people who do not have access to information in their primary language. This can be very, very challenging. And so as an organization, as a community, we should do everything that we can to make sure that information about the crisis is available in various forms and various languages. Of course, people experiencing homelessness and people who live in congregate group settings because of social distancing and so on. So let's take a look at some of the interventions and resources available. And we'll, after this slide here, we may engage the chat a little bit. Let's take a look at some of these interventions briefly. But firstly, taking care of our friends and our family can be a stress reliever, but it should be balanced with care for self. And let's remember that if we want to be good caregivers to other people, and clearly we do, our first responsibility is to care for self. The better care we give ourselves, the more dynamic role taking we will be able to manifest in service of others. And so ask yourself, what is your self-care schedule? What are your maintenance needs? And are you fulfilling those maintenance needs? How much sleep do you need? How much nutrition do you need? How much exercise do you need? How much quiet time do you need? If you can fill your tank, if you can take care of yourself, you're just going to be in a better position to care for your spouse, your children, your aging relatives, your coworkers, your neighbors, and so on. Helping others cope with their stress, such as by providing social support, can also make your community stronger. In addition to self-care, one of the greatest moderators for any kind of stressor, including COVID, is social support. Let's remember that we are all in this together. If my neighbor has COVID, it's likely to affect me in some way. If my coworker has COVID, it's likely to affect me in some way. And so to the extent that I can provide them with some level of social support, it's likely to not only enhance their well-being, but mine as well. During times of increased social distancing, people can still maintain social connections and care for their mental health. I mean, we've got all kinds of really nice technologies available to us that allows us to not only social distance, but also allows us to stay connected to other people and care for others. For example, phone calls or video chats can help us and our loved ones feel socially connected, less lonely or isolated. So let's move to the next slide. But as we move to the next slide, let's take a minute and engage some activity in the chat. Are there any sort of questions or comments that we'd like to engage in the chat for a few moments here? And Laurie, I'll ask you and Shelley to maybe present one or two or three of those questions for us to engage in right now.
James, there are a lot of great comments in the chat, and one of them is from who talks about taking advantage of stress relievers campus has, like yoga and noontime meditation, for example.
Absolutely. Absolutely. There are a number of campus resources available to us, the wellness program, University of Missouri Healthcare, the Learning and Development Team, Learning and Organizational Development Team at UM System. There are lots of resources that we can take advantage of on campus to help moderate the stressors. So by all means, yes, that's a great reflection. How about some other comments or questions from the chat?
Another one is from Karen, who says that she likes to burn a candle and take a 15-minute break when she's having too much screen time. And others are talking about getting up and taking a walk or getting out and enjoying nature as well to help their make their day.
Yeah, those are great responses, and take someone with you. I mean, to take care of yourself and maybe do that individually from time to time. And then after you've met your own needs, maybe reach out and take someone with you the next time around. A very good suggestion, absolutely.
And I agree. I recognize Cherie's comment about even getting up and doing a little laundry or walking around your house provides a little break as well, which is good.
Yeah, very good, very good. Okay, so we'll move out of the chat and get back to the slides, but we'll come back to the chat momentarily. So let's look at some of the healthy ways to cope. Okay. And firstly, let's take a look at, what should we do, if we are feeling ill. We want everyone to know what they should do if they are feeling ill. The university has some very nice resources at renewalmissouri.edu to give us suggestions on what to do to manage COVID, to manage the intersection of COVID with our work lives in terms of hand washing, social distancing, wearing a mask, and so on. And so we want everyone to visit the Renewal Missouri webpage for those resources. And then some other suggestions if we are feeling ill. By all means, consult your primary care physician. If you're feeling ill, take time off, stay at home to recover. Um, Avoid excessive uh, social gatherings of large groups, practice social distancing, wear a mask, hand washing, um, and so on if you are feeling sick. The university has enterprise access to Sanvelo, the Sanvelo app, for those concerned about anxiety, depression, and so on. Uh, the um, the web link is listed here on the PowerPoint. That web link is also listed on the EAP webpage under our tab titled Work Life Resources. And so that Sanvelo app is also very, very important for those concerned about their emotional well-being. The EAP is also available in terms of individual counseling or family counseling in that regard. So just, we want everyone to know what to do if they are feeling stressed or feeling medically or physically ill. Take care of yourself, encourage your coworkers to take care of themselves, um, and we can adjust to the situation. Always know where and how to get treatment and other support services, including counseling or therapy. Again, you can think about the EAP, the Sanvelo app, community mental health centers in Missouri, University of Missouri Healthcare, lots and lots of resources available. Take care of your emotional health and well-being. Um, be mindful of the value or meaning that you're assigning to the COVID situation. You know, the initial response to COVID is likely to generate lots and lots of angst in most of us. But if we slow down and think about it, we want to remember that medical support is available, social support is available, individual counseling is available, and, you know, attaching a more moderate view to the situation, attaching a more moderate view to the stressor is likely to mitigate intensive sort of psychological distress associated with this condition. We're correct that this is a stressful situation, it's a demanding situation, but let's remember that with support, with proper healthcare practices, with medical intervention, we're likely to manage this situation effectively. Let's move on. Let's continue with uh, the notion of intervention and resources. Um, Healthy ways to cope with stress continued here. Let's take breaks from watching, reading, or listening to news stories, including those on social media. Hearing about the pandemic repeatedly can be upsetting. You know, we can oversaturate ourselves with information about the pandemic. So here's a hypothetical scenario for you to consider. Let's say, for example, I go home, I'm already concerned about the pandemic, but I go home and I watch MSNBC for an hour and a half all about the pandemic. That kind of coverage is likely to only exacerbate my existing concerns about the stressor. So on the one hand, we want everyone to stay informed and be up to date about the stressor, about COVID, what's happening, where to get help, how to mitigate the situation. But on the other hand, we don't want people to oversaturate themselves with information. It's just likely to exacerbate an, uh, an already existing stressful situation. So use media in moderation. Next, take care of your body. By all means, take care of your body. Um, Take deep breaths, stretch, or meditate. Try to eat healthy, well-balanced meals. Exercise regularly. Get plenty of sleep. Understand your sleep schedule and follow it. Understand your sleep schedule and follow it. Get to bed on time. Avoid caffeine or nicotine toward the end of the day so that you can get in bed and really get a good night's sleep. Um, and avoid excessive alcohol and drug use. Staying with this notion of healthy ways to cope with stress, Firstly, make time to unwind. Try to do some activities you enjoy. It's possible that a focus on COVID will begin to distract us from the pleasures of life in our family, the joys of doing great work in our teams in the organization, the wonders of having lunch with a coworker. It's possible that COVID can distract us from those pleasures. And so every day I'm encouraging each one of you to engage in activities that bring you joy. Maybe it's a text message to someone you care about. Maybe it's a video chat with someone you care about. Maybe it's going for a walk. But maybe it's reading a book or listening to some of your favorite music. Every day, engage in some activity that brings you satisfaction. Next, connect with others. Talk with people you trust about your concerns and how you are feeling. Remember, one of the greatest moderators of any stressor is social support, particularly this COVID situation. So recognize your social support network and utilize it. Next, connect with your community or faith-based organization. While social distancing measures are in place, consider connecting with your community or faith-based organizations online through social media, by phone, or email. So staying with this notion of interventions and resources, let's talk about mental health. We all know that mental health is an important part of overall health and well-being. It affects how we think, feel, and act. It may also affect how we handle stress, relate to others, and make choices during an emergency. Let's remember that people with pre-existing mental health conditions, such as substance use disorders or severe and persistent mental illness, may be particularly vulnerable in an emergency. Mental health conditions such as depression, anxiety, bipolar disorder, or schizophrenia affect a person's thinking, feeling, mood, or behavior in a way that influences their ability to relate to others and function each day. But let's remember, no matter the psychological condition, support is available. Remember, we have the Sambello app, we have the University EAP, we have Healthy for Life, the wellness program, we have University of Missouri Healthcare, we have community mental health centers in Missouri. There are lots of supports available. People with pre-existing mental health conditions should continue with their treatment and be aware of new or worsening symptoms. If you think you have new or worse symptoms, contact your healthcare provider right away. And call your healthcare provider if your stress gets in the way of your daily activities for several days in a row. It's not unusual for us to have a bad day here or there, but if you typically operate on all cylinders and you feel like you're just out of sorts, take preventive action now. Reach out for support now to get consultation so that you can get back to your high level of functioning. So we've got a list of resources here for crisis situations. Again, we're making this PowerPoint, these slides available to you after the presentation. So you'll have this on file. Keep this list handy. These are resources that you can access 24 hours a day, 7 days a week. Now let's talk a little bit about suicide and some of the risk factors here. Firstly, different life experiences affect a person's risk for suicide, okay? For example, suicide risk is higher among people who experience violence, including child abuse, bullying, or sexual violence. Feelings of isolation, depression, anxiety, and other emotional or financial stressors are known to raise the risk of suicide. People may be more likely to experience these feelings during a crisis like a pandemic. Nevertheless, there are ways to protect against suicidal thoughts and behaviors. For example, support from family and community, or feeling connected and having access to in-person or virtual counseling or therapy can help with suicidal thoughts and behavior, particularly during a crisis like the COVID pandemic. I want to pause for a moment and just again reiterate the significance of social support. Specifically, we live and operate in a very fast-paced, complex organization and world. And because of that pace and demands, we're not always aware of what the person next to us is dealing with. And please remember, I'm sure all of you will acknowledge that something as simple as a good morning, have a good day, would you like to join me for coffee? Is there anything I can do to help? Can go a long way in providing support to someone in need. And I may not know what the person next to me is going through, but a smile, a pat on the back, an encouraging word, and acknowledging a reference can go a long way to helping someone who may be contemplating suicide. Again, I don't have to know the depth of the story. I may not even need to inquire, but if I can just provide support, a smile, a pat on the back, an encouraging word, a good morning, it can go a long way to providing social support to the people on my team, in my organization, in my family, at the market, in traffic. I can look over and smile at someone in traffic and wave at them. All of that is likely to go a long way toward providing a better world, a better community, a better organization, a better self. And so let's not underestimate the significance of social support. It's invaluable. Let's continue. Let's move to the next slide here.
Sorry, I think I'm frozen. I'm working on it.
Okay.
1 second.
So we've got some resources here for suicide. We've got some online and telephone resources for suicide. Whether you've experienced suicide directly or someone in your family, someone on your team, someone in your community, or not, it's important to have access to these resources. And so you may spend some time educating yourself about these suicide prevention resources. They're invaluable, they're rich, they're very deep. The SAMHSA suicide prevention webpage just has tons and tons of information for individuals and organizations. And so let's just kind of educate ourselves in this area. And I want to pause here for a moment and stay on this slide and just talk about what we can do to maybe help someone who may be suicidal. And so let's say maybe you think that someone on your team or in your organization or maybe even in your family is contemplating suicide or has thoughts of that. First of all, it's not unusual for people to think about that. And I would suggest to you that more people have thought about suicide than we may believe have thought about it. Again, it's not unusual. But the first thing that we want to do is, again, we want to offer social support. And sometimes the best thing or the most effective thing that we can do is just create space to listen to someone. One of the most effective things that we can do is just listen in a non-judgmental way. Give the individual an opportunity to just pour it out. Next, we want to encourage the person to seek support. We want to let the individual know that help is available. Counseling services are available. Perhaps they can go to their primary care physician or nurse practitioner. Maybe someone at their church, their clergy can provide support, but we want to point people to resources to support them. And then let's say you don't see the person for a few days and then you see them, you want to follow up and with an encouraging word, a smile, a pat on the back, ask them for coffee. Remember, social support is one of the greatest moderators for someone in distress. Let's go to the next slide. Okay. Now we're looking at ways to recover from COVID. It can be stressful to be separated from others if you have or work exposed to COVID-19. Each person ending a period of home isolation may feel differently about it, and some of the emotional reactions are summarized here. First, we can have mixed emotions, including relief. We may also have fear and worry about our own health and the health of our loved ones. We may experience stress from the COVID-19 pandemic, and by monitoring ourselves and by being monitored by others, I mean, just the vigilance that it takes to stay healthy, the hand washing, the social distancing, the wearing the mask, the avoiding congregate or large group settings, all of that can be very, very stressful. And so other emotional reactions may include sadness, anger, or frustration because friends or loved ones have fears of getting the disease from us, even though you are cleared to be around others. Guilt about not being able to perform normal work or parenting duties while we may have had COVID-19. Worrying about getting reinfected or sick again, even though you've already been cleared from the situation. So there's a range of emotional responses that we could deal with here. Let's continue. So we've got some additional resources for you here. Remember the EAP is available. You've got learning and development at UM System who can do training and development programs for you. You've got University of Missouri Healthcare. Remember, you've got the Renewal Mizzou webpage for lots of resources. Healthy for Life, there's lots and lots of resources available for you. The IRS may have some tax relief sort of strategies. The Department of Labor may have some of those strategies as well. So there are resources for communities coping with stress during an infectious disease outbreak, resources here in the PowerPoint for families and children, and so on. So what I'd like to do now is move out of the PowerPoint and back into the chat for some questions and answers. We could go live, we could go chat. Either way, it's fine with me, but I'd like to move out of the PowerPoint to kind of a question and answer session, a kind of a discussion session now regarding the topic. So the floor is open. And Laurie and Shelley, I'm gonna ask you to kind of moderate and feed questions and help me process some of the responses here. So we can go live or we can go chat. Either way is fine with me.
I'll just mention that we have had a few resources, additional resources added in the chat. One is the Faces of Boone County group has some great resources for, especially for kiddos who are dealing with this, these issues, same issues at this time. We've also had during our HR training conference some really fantastic classes from Extension. So encourage you to look at the Taking Care of You information on the Extension website.
Very good. Thank you. I don't want to cut us off too soon, but we've got a few minutes left, but if there are no other comments, we can begin to move out of the session. I personally want to thank everyone for their contribution today, for coming to the session. For me, the richest part of the session was the chat, you know, the comments, the candid reflections that each one of you put out there. I appreciate the time that you committed to this session. And remember that we're a community of support. And so a smile, a pat on the back, an email, a text message, social support is one of the greatest moderators of any stressors, in addition to taking care of yourself. So let's take care of each other. Let's take care of ourselves. Remember that there are resources available. The EAP is available to you and other campus resources. And we'll just work together moving forward to be successful.
Thank you so much. You guys did a great job.
Appreciate it, James. Thank you.
Okay, thank
I
you.
just wanted to add my thanks, James. Thank you for being here today. And I want to thank all of you for participating. It's been a really, I think, valuable conversation, and I think one that we need to have more often. So thank you all for being a part of this today. And take care of yourself.
Likewise.
Thank you, James.
Bye, everyone.
Goodbye.
Goodbye.